Hi everyone, in this video I'll be talking about taxes applied to nursing salaries in Canada. This will hopefully clarify why some nurses choose to bank their overtime shifts or to get paid out on them, and I also hope to provide a bit of general knowledge about how taxes work in Canada. In this channel, I talk about all aspects of nursing, from pre-nursing to post-nursing graduate programs. If you want to learn more about nursing, consider subscribing and giving this video a thumbs up. I would greatly appreciate that. I also have a free 45-day NCLEX guide on my website, www.simplefitnurse.com, that you can download. Alright, so let's talk about taxes in Canada and how it works. I wanted to make this video in particular because I think it is important to understand how money works, especially since we work so hard for each dollar we earn. In Canada, income tax is one of the most heavily taxed incomes, and each province has a different tax rate that you must pay. In addition to the provincial tax rate, each person must also pay a standardized federal tax rate. The rate of tax is based on your total income. However, it is a little bit more complicated than that, and this is where most people get confused. And I'll explain. First, let me show you the tax brackets for 2020 and 2021. Here are the federal tax brackets in Canada in 2020 and 2021. And here are the provincial tax brackets in British Columbia for 2020 and 2021. Now, if you live in a different province, click the link in the description box down below to find out your tax bracket based on the province you live in. To give you a higher level of understanding, let's consider you make $90,000 a year in the province of British Columbia in 2021. The total tax that I would pay on the $90,000 would be the following: 5.06% on the first $42,000 due to the provincial tax rate, 15% on the first $49,000 due to the federal tax rate. Then I would pay an additional 7.7% on the remaining $42,185 due to the provincial tax rate, and 20.5% on the remaining $40,980 due to the federal tax rate. And then I would pay an additional 10.5% on the remaining $5,631 due to the provincial tax rate. So, to put it more clearly, this is the breakdown of how much I would pay for provincial tax in BC in 2021 if I made $90,000. 5.06% on the $42,184, 7.7% on the $42,185, 10.5% on the $5,631. Total provincial tax that I would pay would equal to $5,974. And this is the breakdown of how much I would pay for federal tax in 2021. 15% on the $49,000 would equal $7,353. 20% on the $40,980 would equal $8,196, giving me a total federal tax paid of $15,549. So as you can see, the more money you make, the higher tax bracket you get placed into, meaning you will pay more tax. But this is inevitable anyways, which means you should always try to earn more money as much as you can. Now let's talk about people banking OT or having it paid out. So this is a concept that I failed to truly understand, and there's a misconception about this, that if you make more money, you will pay more. There actually is some truth to that, but it's a little bit more complicated. So let's say you make a lot on one paycheck. The way the hospital works is it will automatically reduce your taxes from your paycheck depending on how big it is, because it's a percentage. That means that if you properly adjust by banking and paying out your paychecks or paying out your shifts, you can maximize the money you get. But in the end of the year, it doesn't matter because you will get the taxes paid back if you paid more. So the point of doing this is you get your money right away rather than having it paid back to you at the end of the year. So essentially, you're trying to avoid paying more taxes on your paycheck by banking OT in the short term. However, like I said, this does not matter in the end, as you will calculate your taxes and receive either money back or have to pay it according to the appropriate bracket you're in. This is especially important point to make, especially as nurses work usually 4 shifts in a row with 5 days off. So that means some months you may have a proportionately smaller or larger paycheck depending on how the schedule is adjusted to be. Hopefully, this clears up some questions about the banking OT phenomenon and why people do it. I hope you enjoyed this video. If you did, please consider giving the video a thumbs up